Should you be taking antibiotics? Should I be taking antibiotics? What about your kids? Should they be taking antibiotics? And that's the topic of the video. This is Dr. Jason West, where medicine stops and I take over. Great information. Check it out. I get asked all the time, should I be taking antibiotics? And the answer is maybe. Because let's talk about this for a second. Everybody wants to know whether they got sick or an infection, and the answer is because your body came into contact with something bad. However, the only way we can make it so that your body doesn't come in contact with something is to put you into a plastic bubble and not let you have any contact with the outside world. You see, we're always coming in contact with bacteria, with virus, with fungus, with creepy crawlers, insects, everything. And if your immune system is healthy, you are healthy. Now, if you break down the word antibiotic therapy, anti means against, bio means life, or life-killing, so really it's a life-killing therapy. Now, in acute situations and things like meningitis and pneumonia and in different types of infections, I believe that antibiotics are absolutely life-saving. For chronic conditions, for the chronic use of antibiotics, I don't think that that's the right way, and here's why I think that. I think that what we need to do is focus on your immune system being healthy, and if your immune system is healthy, when you come into contact with bad guys, that you can actually not get sick. Now, in those instances when you do get sick, if you're not mismanaging or not abusing antibiotics, they have a better tendency to work. But let's circle around and talk a little bit more about antibiotics. Now, one of the leading causes of antibiotic-resistant bacteria is the mismanagement or abuse of antibiotics because life finds a way. If you put bacteria into an environment with continual antibiotic usage, eventually those are going to mutate and the antibiotics are not going to work against the infection or the bacteria. To combat the antibiotic resistance that's occurring, the CDC Center for Disease Control says that we should make sure that we're using antibiotics appropriately. And there's some guidelines for that. And while I do agree with that, I again also think that the immune system is the most important possession that you have. And if your immune system is working well, it's going to be vital for life. One of the frequent problems that we see with antibiotic usage is the inappropriate prescribing for viruses, for colds, and for flus that are actually caused by a virus or other type of microorganism and isn't responding, or the antibiotic isn't appropriate for that. Then what happens is the bacteria that are in your system, they actually become used to that or resistant to that, and then when you do have a bacterial infection, the antibiotics are not as successful as they could be. Taking antibiotics for viral infections, for many types of earaches, or for viral infections like canker sores and cold sores is not effective and actually creates further problems. And so when you're prescribed an antibiotic, it's really important that you take it the way the doctor recommends and that you finish off the course, that you don't stop short. And then the other thing is it's really important to not save the antibiotics because in future infections, the antibiotics, they will degrade over time. They don't work as well, and you should never ever share your antibiotic prescription with someone else. So what are you going to do if you have an infection? Well, the first thing is the basics. Rest, lots of fluids, chicken noodle soup, sleep in a good sleep sanctuary, and then I prefer to use things that help to upregulate your immune system. My favorite vitamin is vitamin C. So if you're taking liposomal vitamin C, it needs to be somewhere between 2,000 and 5,000 milligrams. Sodium ascorbate, ascorbic acid that you need to work up basically from 1,000 milligrams. And Linus Pauling, who is really the only Nobel laureate in 2 different disciplines, would take up to 30,000 milligrams a day. Now, you can't take that much initially. It'll give you bowel problems and your body's not used to it. But you need to be way more than the 500 milligrams recommended and in that 2,000 to 3,000 range for healthy immune system function. Now, if you're diagnosed with the flu, antibiotics are not the appropriate therapy. It's not the way that you should do because all it does is it's putting anti-life therapy into your body with a microorganism that isn't going to respond to it. I think it's really detrimental. For conditions where you're being prescribed antibiotics again and again and again and again, you need to have a discussion with your doctor about what other options available. And if there isn't options for that doctor, you need to find a doctor that helps recognize or helps you to treat your immune system, because if your immune system's healthy, then you really don't need antibiotics except for those certain instances where we have an acute infection that the body can't keep up with, and then antibiotics are going to be life-saving. Hey, thanks for watching the video on antibiotics. Hopefully it's giving you information on what you should do if you have a chronic infection and some natural alternatives. If you like us, please push the bell so that you'll know when our next video is coming out.